Not a whole lot new, I think, in terms of what's happening with cases of COVID-19 in Niagara and in Ontario as a whole. So this is the Ontario trend. We can see it continues to head downward, and you can probably appreciate it's not quite as steeply coming down as it was to go up. So it will be a while longer before we get cases quite low. We're probably not even quite halfway down to getting it back to a low number similar to what we had in the summer of last year. Part of the reason why I think it's not coming down as quickly is, as I talked about last time, is because we have more variants around which spread more easily. So when we take a look at the reproductive number, which speaks to how many additional cases each current case of COVID-19 will generate, we've got it below 1. So over time, each case is going to produce fewer than 1 additional cases. So that'll cause cases to come down. But it remains higher than what it was, say, in the second lockdown, showing that our lockdown is less effective this time. Similar sort of situation with Niagara. If we're looking here at the reproductive number for us right now versus during the second lockdown, you can see that it's not quite as low. So the current lockdown is not being as effective. And I think that's because of the variants. Fortunately, when we look at the case numbers in Niagara, I think we've made more progress than the province as a whole has, and that we're more than halfway down to getting back to a low number of cases. And so hopefully this is going to be a trend that we're able to sustain and actually get our cases to a very low number in the next few weeks. Just looking at the provincial hospitalization numbers, because of course the crisis that we are seeing in hospitals is really part of the big reason we had to go into a lockdown. And until we really see those hospitalizations relieved, there's probably not going to be the opportunity to safely reopen. We can see with the hospitalizations that with the cases coming down, the number of people being hospitalized is starting to come down relatively rapidly. So that's very good news. Unfortunately, with ICU patients, it takes longer. They tend to have a longer stay in hospital, so it takes longer for that number to start to come down. And we can see it's dipped a little bit, but those ICU numbers remain very high. They're definitely far higher than they were during the second wave, and obviously much higher than we were back when things were going well last summer. I just want to highlight that the province used to talk about 150 ICU admissions being the danger threshold, and we're sitting, just under 800 right now. So the number of people in ICUs remains very high. And just highlighting that even between the second lockdown and then the reopening we had in February, March, you can see the number of people in ICU didn't really come down. And that's partly because I think we reopened before there was enough time for that ICU number to come down. If you look at that first lockdown, you can see how gradually the number of people in the ICUs came down. And I think we're going to see something similar to that. We probably won't get ICU numbers very low by the time we reopen, but I think we need to keep things probably at fairly restricted long enough that we can see that number steadily coming down, so that we have cases low enough that when we reopen, we're not going to be adding anything more onto that gradual number coming down. In Niagara, our hospitalizations look sort of like this. So they've definitely come down a bit. They're holding it sort of flat right now. I think that's partly because Niagara is absorbing some of the hospitalizations from the GTA where they don't have any more room in the hospital. And so that is causing our numbers to maybe stay a little higher than they would otherwise. And likewise, our ICU numbers seem to be pretty flat right now. And again, I think that's in part because we're accepting some admissions from other parts of the province, but also because once someone's in ICU, it often takes 2-3 weeks before they get better. So that number is only going to fall very slowly. The province, of course, did the announcement that they're going to extend the stay-at-home order for another couple of weeks, which I very much agree with was necessary. I am suspicious that we'll probably need to have one more extension on the stay-at-home order beyond that. I think June 2nd will likely turn out to be a bit early. We'll see how cases and hospitalizations trend. But if I really pull out the second quote of this media release, I think it's pretty instructive. Talks about how seeing positive trends can't let up. We need to ensure ICU numbers come down and hospital capacity is protected. But I think this next part is really interesting, that if we stay the course for the next 2 weeks, continue vaccinating record numbers, we can begin looking forward to July and August having a summer that everybody deserves. So really, saying that we're extending this for 2 more weeks, but it's maybe more going to be July and August that we really see things open up. And I think that's perhaps the premier with the language hedging bets that this might not be the last extension to this lockdown, and it might need to go on a little bit longer. And as I talked about at last week's briefing, I do think probably mid-June is a more realistic timeline for when we're going to be able to safely lift the stay-at-home order and start to reopen. One trend that I've been watching has been the mobility data we see and where people are. Of course, we have a stay-at-home order, so we are hopefully expecting people to be staying home as much as possible and not being out and about much. We can see this is provincial data that once the stay-at-home order was decided in early April, we did see a steady decrease in people being outside of their homes. So definitely seeing the stay-at-home order taking effect. But over the last couple of weeks, we started to see that impact degrade with people spending less time at home. And if we zero in where they're spending time, a lot of it is in retail and recreation. A lot of it is going on transit. We're seeing those numbers increasing. And those are worrying, particularly if it is in retail or transit or in any sort of indoor recreation, because that's going to be high risk for COVID-19 spreading. If there's people going to outdoor recreation, certainly that's not as worrying. That would be an area where it's okay perhaps for people to be outside of the home. But given that we're seeing it with transit and we're seeing a fairly large increase, I am worried that perhaps there is a bit more being out and about more than is ideal. And of course, the more people are out and about, the less effective a lockdown is going to be and the longer it's going to take to get cases under control. Looking at the Niagara data, we do see a relatively similar pattern here. So after the stay-at-home order, people started to stay home more, but that seems to be starting to degrade a little bit. And when we're taking a look at shopping and recreation, we can see that that dropped significantly with the stay-at-home order, but now it's starting to creep its way back up. And even in workplaces, we can see here that that dropped off with the stay-at-home order, but there seems to have been a very slight increase over the last couple of weeks in that. And I do worry there's a little bit of degradation of the impact of the stay-at-home order. And that's something we need to reinforce, because the more we are able to stay at home, the more we make this lockdown really count, the faster we'll be able to get out of it and the more aggressively we'll be able to reopen afterwards. So switching from looking at our cases, I just want to quickly take another quick look at our vaccination coverage. And so this is the coverage across the region as of the end of yesterday across many different age groups. And we can see some of these early age groups that were the first to be vaccinated, we're getting very high coverage in these age groups, on the order of 98%, with more people actually booked in for vaccinations in the near future. The 70 to 74 age group is basically getting to the 90% range. So that's really good. The 40, 50-year-olds, these numbers are steadily climbing. They're the most recent groups that are able to get vaccinated. And we actually have a substantial number of appointments here. I think with the 50 to 59 age group, we have another 5-6% of that population already in the queue for vaccination. The 50 to 54% age group and the 40 to 49% age group, I think it's over 10% additional percentage points of that population is actually booked into vaccination. So we're making progress, and our appointments for the rest of this month are basically booked up with these priority groups who most recently opened for vaccination, who will need to be vaccinated soon. Overall, we're close to about 45% of Niagara residents vaccinated, and if we look at just adults, it's closer to about 55%. And I'll come back to that number in a bit. The provinces, of course, this month been rapidly opening up access to vaccines to most populations. And we saw the announcement this morning that the final age groups on this category, the 30 plus band, but also actually the 80 plus band, are all going to actually open up for booking tomorrow. So all of these individuals will be able to start booking for their vaccinations starting tomorrow. So that'll mean all adults now will be able to book a vaccine appointment. If we're looking at the allocations of vaccine, you can see over the last couple of weeks, 50% of vaccine allocation was going to hotspots. We had one hotspot in Niagara, but 113 of them are outside of Niagara, and overwhelmingly they're in Peel region, Toronto, York, and Durham, who make up the majority of the hotspots. And so most vaccine has been flowing to them. Starting this week, the province is going to move back to allocating all vaccine on a per capita basis, which means that we're going to see some of that 50% is going to hotspots start to flow more to Niagara. So there will be an increase in vaccines coming to us. And so you're going to see our clinic vaccinations are going to go up a little bit this week. We look at what our trend with vaccines administered has been. You can kind of get a sense that for a while there's this definite upward trend in terms of vaccinations. For the first couple months, we in public health were basically sending small teams out to vaccinate in long-term care homes, retirement homes, small congregate settings, and that was that dark navy line. Niagara Health was able to start up running a big clinic at the Seymour Hanna Clinic in late February. And so they have been steadily vaccinating there, and it's increased a little bit over time to being close to about 1,500 a day. We in public health started our mass clinics in mid-March, and we've scaled those up over time. So you can see that navy blue line is us. And then we had pharmacies, which is the teal line, and then primary care, which is the orange line, really building us up to a peak. For at one point, we're doing about 4,500 vaccinations a day. Unfortunately, as the AstraZeneca vaccine sort of dried up in Canada and then eventually got a pause, pharmacies and primary care really fell off in terms of their contribution to vaccination. Fortunately, pharmacies are now receiving Pfizer and Moderna vaccine to do vaccinations. As well, primary care is going to be receiving Moderna vaccines in the near future. And so I'm hoping to see those teal and orange lines really start to show up again here and getting us higher. And you'll also notice that us in public health at the navy blue line, we've been able to increase our capacity of vaccinations a little bit in the last week or so as we started to get some of the windfall of that additional vaccine that's going to hotspots. And so we've been able to increase, and you're going to see a further increase, I think, in the next few days as we are able to make use of the additional vaccine coming to Niagara. And so I do expect that we'll be, above 4,000 vaccines a day pretty quickly here, probably even starting today. You probably all saw the announcement, of course, that vaccines are going to open up to all Ontarians 18 plus years of age, which is certainly good news. I just want to quickly touch on what the implications of this are going to be locally. So if we take a look at the number of people who are 18 to 39 who are now eligible for vaccinations, that's a little over 128,000 additional people are becoming eligible for vaccinations. And we know that 12 to 17 age group is scheduled to become eligible for vaccinations by May 31st as well. So you can get a sense that, we're getting close to 160,000 additional people are going to be eligible for vaccinations just in the next couple of weeks. Of course, if we look at how many vaccines we've done, it's about a bit under 230,000 in Niagara so far. So this is a huge additional group of people who are going to be eligible to be vaccinated. If we look at what our vaccine supply looks like, over the next couple of weeks, we're getting on the order of about 20,000 doses that is going to be shared between public health and Niagara Health. And so you can see our supply of vaccine is much smaller than the number of people who become eligible to book for vaccinations. And so I do think people need to be prepared for that. They're not going to be able to book an appointment in the very near future. They'll be able to book tomorrow, but in many cases, they're not going to be able to book an appointment until very far out, just because the vaccine supply is not coming in the same speed as people are becoming eligible to book for vaccinations. And if you're looking at this 20,000 and 160,000 or so people, that's talking maybe 8 weeks. Obviously, not all people in that group are going to try to sign up for vaccinations right away. But even if we're looking at 4 or 5 weeks out for the initial group who wants to get vaccinated, that's going to be pushing them well into the latter part of June probably. And as it stands right now, we don't even have confirmed shipments of our vaccines for much later. So we only have appointments into the early part of June up right now. We'll hopefully get more information to get more clinic appointments up in the near future. But I do think we're going to see a lot of people who are eligible to vaccinate, but not able to get an appointment in the near future. And I think we need people to be prepared that might be the eventuality. Of course, as we do get more vaccines out here, that'll hopefully help us get the vaccine coverage up. I talked about how we're at 45% coverage right now, 55% when we look at adults. And I've shown before, this is a graph by the Public Health Agency of Canada saying that once we get up to about 75% of adults, we'll get to a stage where when we reopen, our hospitalizations don't really spike up. Where we are right now, which is about 55% of adults vaccinated, if we did reopen, we would see a spike in hospitalizations, exceeding this dotted line here, which would be the hospital capacity. And so we are probably looking at a little bit longer before we can really reopen. My expectation based on current vaccine supplies, it'll probably be around the second week of June that we get to 75% of adults vaccinated. And so that really aligns with that timeline I suggested, that the middle of June is probably when we're going to be able to really reopen. And that aligns with when the federal modeling shows that we'll have enough vaccine coverage to do that. And everybody probably saw this news by the federal government, which is really, I think, building on that 75% threshold, saying how things could really change as we get through that point. So, right now we're here where cases are high and we're still building up vaccinations, and we're of course in a stay-at-home order. But by this summer, once we get to 75% of people vaccinated, there'll be opportunity for restrictions to live, and we'll be able to start doing small outdoor gatherings with friends and family. So really starting to widen our social networks from just our household to be around other people. We'll still need to keep up with physical distancing. We'll need to be wearing masks in public. We'll need to avoid crowds, but we'll be able to start to normalize to some of these outdoor activities where we're with small groups. And I think that'll be something really welcome for everybody after the difficulty of lockdown over the last couple of months. And then as we get into fall and 75% of people have 2 doses of vaccine, we'll be able to actually start to lift more. And so there'll be many more indoor types of activities that can occur. Indoor sports, family gatherings indoors, just in time for when the weather's starting to turn worse and we can't do those things outdoors, we'll be able to start doing them indoors. I really expect universities, colleges, schools really to start to reopen to something much closer to normal with this fall as well, with that happening. The pandemic won't be over by this time this happened. I think it's important to recognize there'll still be a lot happening. We'll still have to keep up some of our measures, such as wearing masks, keeping distance in certain spaces. We probably won't have any kind of activities with big crowds, but we'll start to actually see us returning much closer to normal as we get into the fall and get 2 doses of 75% coverage across Ontarians. And so I think that's something to look forward to. And I think hopefully this can be motivation for us to really hold out for the next 3 to 4 weeks to really stay at home and make sure we get vaccinated, because there's some good things I think for us to look forward to once we get past that hurdle. Last thing I just want to touch on is a couple bits of new science that's coming out around vaccination. I know with the AstraZeneca vaccine being paused, many people who got a first dose of that vaccine are wondering what's going to happen with their second dose. And we'll be hearing hopefully a provincial announcement of that sometime this week. One option is people could get the second dose with AstraZeneca vaccine again. We do have more AstraZeneca vaccine coming to Canada. And we've seen that the clotting issue that is the concern, which is why we've put a pause on that vaccine in the province, that clotting issue doesn't seem to occur very often on a second dose. It's really mostly a concern with the first dose of the vaccine. And so there could be an opportunity that people who have got a first dose of AstraZeneca vaccine will be able to get their second dose of that same vaccine later this summer. That's indeed what British Columbia, I believe, is doing. The other possibility people have talked about was that you would get a second dose with maybe a different vaccine, with Moderna or Pfizer, something different. And we're waiting to see some of the research around that. And the UK has been doing some research around this, and some initial results came out here. What they found is that, with mixing of an AstraZeneca dose followed by a Pfizer dose, while it seemed to be safe, the side effects were more likely with that. Relatively mild side effects, nothing concerning like a clotting issue, but that is one of the drawbacks it's looking like. Unfortunately, there wasn't enough data to assess whether or not that the mixing and matching of vaccines was going to be more effective. But I think this will be something that the province will be taking account probably as they make a decision on whether to do second doses with AstraZeneca or do second doses with a different vaccine, given that doing it with a different vaccine does seem to cause more mild side effects. And then the other thing I think that a lot of people have been wondering about is second doses. And we saw the announcement a couple of weeks ago that the highest risk healthcare workers, people working in hospitals, treating COVID patients, long-term care home workers, retirement home workers, the people most likely to get COVID-19 are now going to be eligible for a second dose earlier than the 16 weeks. And I think many others are hoping to get that second dose earlier. And what I'd like to do is actually caution people that it's maybe not necessarily the best thing to get that second dose earlier. we see with a lot of vaccines that if we delay a second dose of vaccination, sometimes we actually see better protection from a later dose of vaccine. And part of the rationale of delaying the second dose in Canada, as well as in the UK where they did this, was that we might actually see better coverage with that second dose, better protection, as well as we'll get more people vaccinated with the first dose, which really gets the maximum amount of benefit to the largest amount of people. And actually the research coming out of the UK, where they're looking at people who got a Pfizer dose at 3 months versus 3 weeks, is actually in the elderly population where they studied it, it actually gave far better immunity by having that delayed 3-month dose of Pfizer rather than the earlier 3-week dose of Pfizer. It was actually on the order of 3.5 times more antibodies were present if you got that later dose of Pfizer vaccine. And so it really does seem like getting that later dose of your vaccine is actually going to give you more protection over the long term and better protection over the long term. Now, there is a trade-off, of course. It means that in the short term, you're going to have a little less protection, but you're going to have a lot more protection longer term. And maybe there's a risk benefit that people need to think about. If you're in a high-risk situation, you're working in the hospital with COVID patients, maybe it does make sense to get that earlier second dose because you have a lot of risk right now. And of course, as COVID cases come down, you're not going to have as much risk going later on. So maybe you do want to get that second dose earlier. But I think for many of us, it may be better that we get the better protection later on, especially if we don't have really acute short-term risk for COVID-19, that by getting our second dose at 3 or 4 months, as is currently scheduled, we'll actually be better off over the long term. And so hopefully people can be mindful of that, and we can be mindful that getting a second dose right away isn't necessarily always going to be the best strategy for all of us. With that, I'll turn it over for questions.
Great, thank you. So we'll start going through the list, and we'll have an opportunity for everybody to ask a question and a follow-up, and then we'll open it up if we have time for additional questions. So to start off, Ludwig, I will give you the opportunity to unmute.
Thank you. Can you hear me?
Yes.
Yes.
Excellent. Great. Hello, everyone. Hope everyone's well. Hello, Dr. Hergy. So with the mobility data showing you that there are some changes happening now, could you talk a little bit more about that? What is it that you think people are doing? And is there any risk now that we're seeing more and more nice days outside and great weather, and certainly many people probably want to get out and get together and do all the things we want to do. With that, do you see is that realistic that might spike the spread? And if so, what's a realistic scenario for for another spike of cases driven by what we've seen before, like social activities and stuff?
Yeah, I don't have really fine data on what people are doing, but it really seems to be retail and recreation, as well as going on transit that has gone up. And going on transit is, of course, people going out and about in the community somewhere. If we are looking at the reproductive number earlier, and I'll just pull up the Ontario one here, we are still seeing the reproductive number below 1 despite that additional mobility. So I think it does mean that despite that additional mobility, we're maybe not going to see a spike in cases, but we're not going to see the cases come down as quickly as we would otherwise, because with people being out and about, there's going to be more opportunity for infection to spread because people are more likely going to be interacting with others. And I think that's really the risk here, that it extends us being in the stay-at-home order longer. It delays our ability to really have a more sustainable reopening where things can really start to normalize earlier on in the summer than they would otherwise be able to. I think that's where the risk is. Now, if people want to be out and about, technically we're in a stay-at-home order. We're supposed to stay at home, but I'd interpret to say that we should be staying with our households as opposed to just staying at home. And if you do want to go outside, you can do things with your household. Go for a walk, go for a hike with your household, spend time in a park with your household. I think that's the really key part. Getting out is okay as long as you're doing it with only your household and not starting to spend time with friends, extended family, co-workers, and others. Because if you're with your household, you're limiting your contacts to the people you're already in close contact with. You're not creating new opportunities for infection to spread to others. If you're starting to do those outdoor activities with friends, extended family, coworkers, and others, now you're creating opportunity for infection to spread to different people. And that's where we could see cases start to increase or maybe just decrease less quickly. And that's, I think, what we really need to avoid.
Thank you. And follow up, Ludwig?
Yes, thank you. So with that and with adults over 18 now able to book vaccinations, looking as we have a summer coming ahead of us, is it realistic that it will be considered safe and okay to maybe get together with a group of friends that you have sort of the same idea as that social bubble that we had initially very early on in the pandemic? But is it realistic that you can get together with your friends at some point during the summer with a select group of people and just hug it out and be inside without masks and just hang out under normal circumstances, if you will?
I think we'll be partly there. I think we'll be able to do that kind of activity with a relatively smaller group. So let's say 5, max 10 people. The only thing is, I think it's going to have to be outdoors this summer. Once we get to the fall, it can be closer to indoors, but I think it's going to be only outdoors. But that's, of course, a huge change from how we've been living our lives the last few months. And I think that's something we can look forward to. Actually, maybe not too far away. I'm thinking that could be, by Canada Day, we'll be able to partake in that kind of activity again. Key thing is, though, that we need to have a dose of vaccine before we start to do that. So everybody who's becoming eligible for vaccine tomorrow are already eligible. The key thing is they need to sign up to get their shot so that they're able to partake in that over the next 4 to 6 weeks once we're starting to be able to do that.
Great, thank you. Next up, we have Paul.
Can you hear me?
Yes.
Yep.
Oh, great, thank you. I'm working on 2 computers, so that's why I'm sometimes looking sideways. Dr. Hergy, with the, I thought you could clarify something with the possible reopening. The province has mentioned June 2nd at least, the restrictions. Mm-hmm. You've often talked about keeping things, under wraps until at least mid-June, but then the Premier's office had mentioned in the press release July and August that we could really enjoy. So, there might be some mixed signals. Do you think that realistically we might be looking at possibly the end of June before restrictions could be lifted?
It's certainly possible. I think it's going to all come down to, conditions on the ground. What does it look like in terms of cases, in terms of hospitalizations? And what does that say about when we can reopen? Just looking at where we are right now in terms of cases in the province, coming back to this graph, I just don't expect that in 2 weeks is going to be to a very low level. I think we're going to need longer for that to come down. And I walked through a little bit of this in more detail of why I think it's going to be closer to about another 4 weeks for us to get cases down to that level. Obviously, if cases come down more quickly, that's great. And that allows things to maybe reopen more early. But I don't think we're going to get there within the next 2 weeks. I think there's going to need to be an extension to get there. And I think, if you're looking at mid-June, that also then aligns with what the Public Health Agency of Canada has said about that 75% vaccination rate. It's going to take us until mid-June to get there. So I really feel all signs point to that being the more likely timeline. And, I would, have advocated the province should have just done a 4-week extension to the stay-at-home order so people would have a clear signal of what is going to be most realistic. Obviously, they decide to not do that, but the important thing is that they did extend it. And so, I think that's the most important thing, but I think it lost the opportunity of maybe giving a bit more predictability to everybody of what would come next.
And a follow-up?
Yes, and with the opening of eligibility to youth and young adults, you'd mentioned that the number of people eligible will be, at least for the short term, much greater than the vaccine availability. I guess that creates the possibility of frustration that people are calling, trying to set up an appointment. So I guess should we, at least in the near future, should people prepare themselves for the fact that they won't be getting appointments necessarily the next week, or possibly even it might be 4 or 5 weeks before they can get an appointment, just so people don't get their expectations too high?
Yeah, I think it's really important we set that expectation that appointments aren't going to be available in the next week or two. As we stand actually in public health, our appointments through the rest of May are pretty much all filled up. There's very few spots left at this point. So even, the first person who comes on tomorrow to register might be looking actually at the start of June for the earliest appointment that they're able to get. So I think definitely there needs to be that expectation that it's not, you're becoming eligible to book, which is great, and hopefully you'll have some certainty of when your appointment is, but it's not necessarily going to be in the near term. The other thing to highlight here, though, is that this is the provincial booking system. What you're going to see with public health and Niagara health clinics. There's going to be opportunity to get vaccinations in pharmacies again because they're getting Moderna and Pfizer vaccine. Primary care is going to be getting Moderna vaccine. So for those who can't get an appointment in the near future, definitely reach out to your local pharmacy, to your primary care provider, see if you have an opportunity to get vaccinated through those avenues as well, because that's going to be some additional opportunity to maybe get vaccine a bit earlier.
Great, thank you. Next we have Alan.
Hi, nice to hear from you again. Just wondering, I was looking at the vaccine stats published today. You guys did 1,906 doses yesterday. That's by far the most that public health has done. I'm wondering, you're talking about actually, ramping up dosages, administration from there in the week to come. I'm wondering if you have, is there going to be issues with getting facilities large enough to accommodate more distribution, staff limits on being able to do that?
Yeah, no, the limiting factor for delivering vaccines really all along has been the amount of vaccine supply we have. We have facilities to do more, we have staff to do more. It's really about having the vaccine that we can actually make maximum use of our facilities and our staff. And so with more vaccine this week, and even yesterday, as you pointed out, we are able to vaccinate more. Today, we should be over 2,000 in terms of doses we're going to be able to do. And that's just because we're getting more vaccine this week. So we're going to be able to do larger numbers.
Wow, okay.
And a follow-up?
Yes. Okay. Heard reports over the weekend of large groups gathering in Niagara-on-the-Lake, Niagara Falls beaches or tourist areas, that type of thing. Wondered if you'd heard similar concerns, and if there's any ideas about perhaps ramping up enforcement or something like that to get people to better adhere to public health guidelines.
Yeah, I haven't specifically heard that, but don't necessarily have eyes and ears everywhere to know what's happening in the region. If there were big crowds, I think that's certainly very unfortunate, and I would hope that the relevant bylaw offices, in this case it'd probably be Niagara Falls bylaw from what you're describing, as well as the police will do what's necessary to make sure our current rules are enforced, that if people are out and about, that we're minimizing crowd size, spacing people out appropriately so we minimize the risk of infection spreading. And of course, making sure if people are gathering, it's in a facility that's permitted to be open and not a place that's been closed by provincial regulation.
Well, thank you.
Thanks. And next we have Randy.
Yeah, hi, thanks for taking my question. I'm wondering about homebound people. The province says that homebound people under exceptional circumstances can be given single doses brought to them. Why hasn't Niagara Public Health done this?
Yeah, what we see is some of the complexity around moving Moderna and Pfizer vaccine. You're probably well aware that these need to have special freezers, and that's because they're unstable when they get out of the frozen state. And actually moving these vaccines, the guidelines on them set by the manufacturer and by Health Canada says that you should not be routinely moving these vaccines or moving them in a single dose. And once you've moved it once, you shouldn't move it a second time. And so it makes it very hard to actually develop a strategy where you're going to visit homebound persons when you have a vaccine that you really shouldn't be moving. And if you do move it, well, you can drive to one place, administer a dose, but you can't take any other doses with you to move on to a second trip because you're not supposed to move it more than once. The Johnson & Johnson vaccine has been approved in Canada. It's arrived in Canada, and we're going to be receiving it any day now, hopefully. And our plan was that as soon as we got that vaccine, that would be the vaccine that we would be able to use, because it's very flexible in terms of being able to move it. We could, take it on a trip, hit multiple homes at once, vaccinate large numbers of homebound people all in one go. And of course, since it's a single dose of vaccine, you don't actually need to come back and vaccinate people more. So that's what our current plan is. We're just waiting for Health Canada to clear that the lot that we've received doesn't have any contamination issues.
Okay, so when would that start? And also, Hamilton has managed, Hamilton Public Health has done 1,300 of these homebound injections. Are they using AstraZeneca, or why were they able to do it and you're not?
Yeah, my understanding is in Hamilton, they use the Moderna vaccine for this purpose. So they decide to use it outside of the normal guidelines of how to handle the vaccine, making that risk benefit that the vaccine stability will be affected. And there's a chance that maybe the vaccine won't be as effective or be effective, but they felt that the risk for this population was enough that they needed to proceed with that. What we've seen in Niagara is that the homebound population generally hasn't been getting sick with COVID-19. So we don't feel that there's that same pressure to rush and perhaps use a vaccine that might not be fully effective if we do move it outside of its normal guidelines. This is a group, of course, because they're staying home, they don't have a lot of contacts with the outside world. So that does minimize the risk of infection. So we've made a different risk balance decision than Hamilton has. We hope that, as soon as we get the okay that we're going to get the Johnson & Johnson vaccine, we're going to basically be able to start the next day. We've got all our plans in place. We're really just waiting on that vaccine product to arrive.
Thank you.
Thanks. So next up we have Penny.
Hi, my question has to do with vaccinations again. Dr. Hirji, you've been very clear about preparing people for the fact that they may try to get appointments as the age limit goes down, but there won't be enough vaccine. In order to explain to people the process of going online and booking, I'm just wondering whether you will still plan clinics into the future that far ahead so that people can make appointments. They will know, okay, I have to wait 4 weeks, but at least I have an appointment in 4 weeks. Or will they just be unable to make an appointment?
Yeah, I think the first groups who go on to register, they'll be able to see appointments out there. We've got appointments up for the next 3 weeks, though for the next 2, they're pretty much all booked up at this point. We're in the process of actually getting a 4th week up now, so that will be the 2nd week of June. So they will see some appointments they can book into. Beyond that, we don't really have enough insight into what our vaccine supply is to know how many appointments to book it up. And so we're doing some internal discussions around maybe at least putting some up, a lowballing an estimate that we can then maybe increase later on once we get more clarity. Unfortunately, the provincial announcement to go open up to all of these age groups suddenly landed in the media release this morning. So we didn't have a lot of advance notice to try and figure that out. So there'll be some people who will go on, will see an appointment in early June that they can register for. Unfortunately, I think there will probably get to a point where those vaccine appointments all get filled up and people won't be able to book further. And I also highlight here that the province announced that they want the week of June 14th and the 21st, I believe, to really be focused on vaccinating the 12 to 17 years of age, those school children. And so that's also going to maybe delay some of these other groups getting vaccinated because we'll have to pivot those 2 weeks to really focus on those children.
Great, and a follow-up?
I guess it would just be for people to keep going online, keep checking, keep putting their names in for pharmacies and primary care, wherever they can get an appointment.
Yep, absolutely.
Okay, thank you.
Thanks. And up next, we have Richard.
Hi, thanks for having us again today. I just wanted to clarify, I know we've seen some reports of more people traveling. Do you have can you define that a bit more? Is it what's the increase that we saw from a couple of weeks ago when you said more people were staying home? If you can quantify that at all.
Yeah, I don't have a really precise number that I can quantify here. You can kind of see on the graph what the decrease has been. So, you're probably looking at fewer than 10% of people are stopped staying home based on that graph. So it's not a huge number, but it is a small number. And of course, the trend is such that maybe that number might increase over time. And that's the worrying part. Fortunately, I don't have anything more precise I can share at this time.
Okay, just to clarify, sorry, you said fewer than 10% are actually staying at home?
Well, I think of the people who were staying at home, about 10% of them seem to have stopped staying home over the last couple of weeks. I think it's far more than 10% of people are spending most of their time at home, but I don't actually have an exact number. The way we get the data is not really boiled down into the number of people, but more sort of the general trend that we're seeing. And so I don't really have absolute numbers I can share on that front.
Okay, and my follow-up is just, there's, there was a good amount of people in Niagara on the Lake this weekend, but if people are gathering in parks and stuff like that, and you've said, you want it to be the same household, is it okay if the park's busy, but it appears to be people all 6 feet apart, generally from the same household? Is that something you would encourage, or does it become dangerous once the park gets busier?
Yeah, I'm not necessarily say I would encourage it, but I would think it isn't a huge risk. If people are with just their household, they're managing to maintain 2 meters distance from any other group who's in the park, that minimizes the risk. There will be very little risk of infection spreading from one group to the other. But that being said, I think it's often hard to maintain that level of separation. And I do worry if more and more people come to the park, at some point, there's not going to be room for people to space out and people are going to stop spacing out. So, I wouldn't necessarily encourage people to, go to a park. What I would encourage people is that whatever you do, stick to just your household. And if you do that, I think you'll be relatively safe.
Awesome, thank you.
Thanks. Next up, we have CHCH editors. I don't know if anyone's there who has a question. Okay, it's not looking like it, so we'll move on. And then next we have Lisa.
Hi, thanks very much. The editors will not have a question. Dr. Hirji, I'm wondering if you can go back to the plan to vaccinate youth aged 12 to 17. You expect that to start in the second week of June? And how do you expect that will roll out in Niagara? Will it be through the schools or pop-up clinics? I'm wondering if you can give us a bit more detail.
Yeah, we're still figuring out what that plan is and talking with our school board on it. What I can say is that the vast majority of people we would want to vaccinate through a mass vaccination clinic. We have that existing infrastructure up and running. We know we can do large volumes of people that way. So that would really be the ideal of how we're going to vaccinate most of people within this age group. There is an opportunity if we saw, certain parts of the province where there's a school where maybe people are disadvantaged, they're less likely to sign up for a clinic, maybe they don't speak English, maybe they have transportation challenges, that maybe we would look at doing something special in that area, such as a more local clinic or pop-up clinic for those individuals. But our preference is really to try and drive as many people through a mass vaccination clinic where we know we can get lots of people vaccinated as quickly as possible.
Thank you. And so the idea, do you understand then, would it be to have students fully vaccinated by September so they could get their second dose before they go back to school?
Yeah, that seems to be the province's intention, that first doses would be done in the month of June, and then second doses could be done in the month of August. And so once we go back to school, you'd hopefully have both teachers and students 12 to 17 fully vaccinated, really bringing down the risk and making sure schools are most likely to be able to stay open for in-person learning the entire school year.
Thanks very much.
Okay, so now that we've gone through the list, if anybody has any second follow-up questions that they'd like to ask, if you can just let me know in the chat and I will let you unmute and ask the question. Okay, not seeing any. So I think that is all for today. Thank you everybody for coming, And again, our next week's media briefing will be moved to Tuesday, the 25th from 11 to 12. Thank you.